How can we manage the case of pre-cervical cancer? Good morning, doctor.
Hi, good morning.
It's Cervical Cancer Month. Please tell us, doctor, how can we stay safe?
Yes, you know that knowledge is power. You can stay safe by screening. This is by performing a Pap test that is to detect the precancerous cervical lesions of the cervix and/or you can perform an HPV virus test. That is the virus that causes these cervical changes. These changes, if left untreated, it can lead eventually to cancer cervix. By the age of 21 to 29, you can have a Pap test every 3 years, and then by the age of 30 to 65, you can be offered the Pap test, an HPV virus test, or a co-test. This will have a screening every 5 years. And then after 65 years, you don't have to be screened again if the other Pap smear or an HPV virus screening test are normal. All these tests can be done here in the clinic at the office.
What are the risk factors of cervical cancer?
Well, the HPV virus is the most important virus causing cancer cervix. It's one of the sexually transmitted diseases. There are many types for HPV virus. The most important is the oncogenic type, which is number 16, 18, 31, 58, 66, and 68. Next is the HIV, which are also one of the sexually transmitted disease and can cause decrease of the body immunity. And the smoking, the oral contraceptive pills or any hormonal treatment more than or equal to 5 years, the multiple pregnancies more than or equal to 4 times.
What is the clinical picture for the pre-cancer condition?
Well, most of the people that has HPV virus doesn't know even that they have this virus because the immune system gets rid of the virus within 2 years. But other people presented with warts, these should be offered the Pap test because these warts are warning signs. But usually the virus that causes the warts will not cause cancer cervix, but we have to search for the other oncogenic types for the virus. Other presentations include vaginal bleeding, which is abnormal, especially that after intercourse that is called the contact bleeding, or any bad smell odor, vaginal discharge.
What are the pre-cancer conditions that you are afraid of?
By Pap test, you can have a low-grade squamous intraepithelial lesion, high-grade intraepithelial lesion, or atypical glandular or squamous cells, that is called ASCUS. All these necessitate that you go further management for the precancerous cells.
How can we manage the case of pre-cervical cancer?
Yes, first we have to avoid the risk factors for having cancer cervix. That is by avoiding HPV virus by wearing condoms if one of the partners is affected, or we can avoid smoking and multiple deliveries more than 4 times, or by avoiding hormonal therapy more than 5 years. Next is that if we find any of the precancerous lesions by Pap smear, we have to go for confirmation by colposcopy and a directed biopsy. And next goes for the treatment really of the precancerous lesions, that is for cryotherapy by freezing the part which is affected by the precancerous lesion, or by the LEEP or the LEEDS, that is the large loop excision of the transformation zone, or by even surgical removal like a comb biopsy or by laser.
Thank you, doctor.
You're welcome.